Okay, picture this. You're just chilling, maybe reading a book, and the house is totally quiet. And then all of a sudden, your cat shoots up, crouches down really low with their neck stretched out, and starts making that sound. You know the one. It just makes your heart stop for a second. It's this awful, hacking, gagging noise that every cat owner dreads. And then up comes this gross-looking clump. Right away, your mind just starts racing, doesn't it? Is this bad? Should I be worried? What do I do? It's a really scary moment, and you're absolutely right to be concerned.
So let's cut through that worry. In the next few minutes, we're going to figure this out together. We'll talk about what's actually normal when it comes to hairballs, what the serious red flags are, and most importantly, how you can help your best friend feel a whole lot better. So what exactly is that thing they just coughed up? Well, if you want to get fancy, the medical term is a Trichobezoar. I know, it sounds super complicated, but it's really just the clinical name for what we all know as a hairball. Basically a little wad of undigested hair mixed with some digestive fluids.
Now here's something that might surprise you. Even though we call it a hairball, it's almost never actually round. It usually comes out looking more like a little tube, kind of like a cigar or a sausage. And why is that? Well, it's because it gets squeezed into that shape as it travels up through your cat's esophagus. You know, hairballs are really just let's say the less glamorous side effect of a very healthy habit, your cat's grooming. Their tongue is amazing. It's covered in these tiny backward-facing hooks that act like a perfect little comb, grabbing all that loose fur. Most of that hair just passes right through their digestive system, no problem at all. But sometimes, some of it stays behind in the stomach, clumps together and, well, eventually it has to come out. And you've probably noticed that some cats seem to get them more than others. It's no real surprise that long-haired breeds, like Persians and Maine Coons, are at the top of the list. Older cats can have more issues too, partly because they've gotten so good at grooming over the years. We also see it a lot in cats that overgroom, which can be a clue that something else is going on, like stress or even a skin allergy. And of course, you'll probably see a lot more of them when they're shedding heavily. So here's the million-dollar question. What's actually normal? To be honest, for a healthy cat, bringing up a hairball once every week or two can be totally fine. Yeah, it's not fun for anyone involved, but it doesn't automatically mean you need to panic. Okay, this is where you, as their owner, become a super important detective. Let's talk about the difference between a normal nuisance and a real red flag. If your cat hacks, brings up a hairball, and then 5 minutes later is running around playing like nothing ever happened, that's usually just a nuisance. But the red flags start waving when they're retching and nothing is coming up. Or if they seem tired, they don't want to eat, or you notice issues like constipation or diarrhea. That's when it signals something more is going on. And this leads us to a really, really critical point that so many people miss. That hacking sound? What if it isn't a hairball at all? One of the most common things that gets mistaken for a hairball is actually a very serious condition, feline asthma. Let's be really clear here. A hairball is a digestive issue. It's happening in the stomach. You see gagging, retching, and it usually ends with, a hairball on your rug. Asthma, on the other hand, is a respiratory issue. It's in the lungs. The symptoms are coughing, wheezing, and fast breathing. And here is the most important part. An asthma attack will never produce a hairball. And making that distinction is so critical because feline asthma affects somewhere between 1% and 5% of all cats. That might not sound like a huge number, but it means millions of cats are living with this condition. Mistaking that cough for a simple hairball could mean delaying treatment that they really, really need. Okay, so let's shift gears and talk about what we can actually do about this. The best news is that there are some really simple, really effective things you can do right at home to help prevent hairballs in the first place. First and foremost, daily grooming. Seriously, this is your best line of defense. Every single hair you get out with a brush is one less hair your cat has to swallow. Next, take a look at their diet. There are special hairball formula foods that are high in fiber, and that fiber helps everything, including hair, move through their system smoothly. Third, you can try some hairball lubricants. They're usually these tasty gels or treats that just coat the hair and help it slide right on through. And finally, think about hydration. Adding wet food or a water fountain can encourage them to drink more, which is just fantastic for their overall digestive health. But look, sometimes home care just isn't enough, and that's totally okay. Knowing when to call for backup is key. So let's talk about when it's time to call the vet and what that visit actually looks like so it feels less intimidating. When you go in, your vet's always going to start with two things: a good physical exam and just listening to you. You're the one who sees your cat every day, so what you've noticed is incredibly important. From there, we might suggest things like x-rays or some blood work. This isn't just to be difficult, it's to make sure there isn't a dangerous blockage or some other underlying issue causing the problem.
So, here's your checklist. It's time to make that call if you see any of these signs. If your cat is trying to bring something up over and over again, but nothing comes out. If they won't eat for more than a day. If they just seem really tired or down. If you notice any other tummy troubles like vomiting or diarrhea. If their belly seems bloated or feels hard. And especially if you see any wheezing or them breathing with their mouth open, that could be an emergency.
So if you remember only one thing from our little chat today, please let it be this. While a hairball every once in a while can be normal, frequent hairballs are not. You should think of them more like a symptom, a little signal from your cat's body that something else might be going on that needs our attention.
Remember, this information is for educational purposes and is not a substitute for professional veterinarian advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.